Okay, imagine this for a second. It's the 10th century, you're in Europe, and you get really sick. What do?
Pray, hope for the best.
Mm.
Maybe find someone who knows a few herbs.
Exactly. Not a lot of great options. Now, same time period, 10th century, but you're in Córdoba, Muslim Spain, you're sick.
Ah, well then you'd likely head to the local hospital.
And get treated. For free.
That's the truly surprising part, isn't it?
It really is. Free, public health care, hundreds of years before anything like it became standard in, well, the rest of Europe. So today, for this deep dive, we're heading back to Al-Andalus.
Our mission, if you will.
Yeah, our mission is to unpack how this incredible system actually worked, why they developed it, and maybe what lessons we can still learn from it today.
It's a key point because, while Europe was, let's say, medically underdeveloped in many ways, Al-Andalus under the Umayyads was, well, it was incredibly advanced.
One of the most medically sophisticated places on Earth, arguably.
I'd say so, yeah. They were setting a standard for public health long, long before Europe even really conceived of it in the same way.
So let's picture it. What did hospital actually mean in 10th century Córdoba? What were these places like? Did they have a proper name?
Oh, absolutely. They were called bimaristans. It's a Persian word.
Persian, okay.
Yeah, bimar means sick, and stan means place. So quite literally, a place for the sick.
A place for the sick. Simple enough, but these sound like they were anything but simple. Tell us more about what made them so advanced.
Well, forget basic huts. These were complex institutions. Think separate wards for men and women, for starters.
Okay, that makes sense.
And different sections for different types of diseases, too. You wouldn't put someone with a fever next to someone with a broken leg, for example.
Logical. Sort of like basic infection control, almost.
In a way, yes. Plus, they had pharmacies right there in the hospital, giving out free medicine.
Free medicine as well.
Mm-hmm. And staffed by trained professionals, physicians, surgeons, nurses, real teams.
And I read they even kept records. Medical records.
Yes, detailed medical records, patient histories, treatments given, outcomes. It was all documented. They even had libraries filled with medical texts.
Libraries within the hospital. What kind of texts?
All sorts. Arabic texts, obviously, but also translations from Greek, Latin. They gathered knowledge from everywhere as a very systematic approach.
Wow. And the accessibility.
That's maybe the most striking part. Open 204/7. No fees. None.
So admission was just based on need, not who you were or how much money you had.
Exactly. Purely based on medical need.
It points to this idea of truly universal care, something we still talk about so much today.
That kind of commitment, it must have come from somewhere deeper, right? It wasn't just about having good doctors. What was the philosophy behind it?
A lot of it connects back to Islamic teachings. There's a very famous saying attributed to the Prophet Muhammad, for every disease, there is a cure.
And that wasn't just taken as, a comforting thought. It was seen as an imperative. It motivated rulers, scholars, everyone to actively support medical research, train doctors properly, and build these bimaristans.
So healthcare was seen as a kind of civic duty almost, stemming from religious principle.
Absolutely. A societal obligation, not just optional charity.
And this religious idea found political backing too, right? The rulers, the Umayyads, they saw this as important for their state.
Very much so. They viewed science, good hygiene, public health. They saw these as markers of a truly civilized and advanced society. It was part of their political vision.
So they invested heavily.
Huge investments in public works, yeah. And healthcare was a major part of that. It wasn't an afterthought.
It's that alignment then. Religious principles saying do this and political vision saying, yes, this makes us stronger and better.
Precisely. That combination created the conditions for these incredibly advanced hospitals to flourish. It was practical and principled.
Okay, this sounds amazing, almost too good to be true for the medieval period. But how did they pay for it all? Free medicine, 204/7 care. That costs money.
The funding. It was actually quite ingenious. They used a system called WAF.
Wow. What's that?
It's essentially a charitable endowment. Wealthy people, rulers especially, would donate assets, money, sure, but often buildings or, say, farmland.
Okay. And how did that fund the hospital?
Well, the income generated by those assets, rents from the buildings, profits from the farm, whatever it was that income was dedicated, in perpetuity to cover the hospital's running costs.
So the hospital had its own independent income stream.
Exactly. It made the healthcare system largely independent of, the government's day-to-day budget or political changes. As long as the WAF endowment existed and produced income, the hospital could keep operating.
That's remarkably clever. Sustainable.
It really was. Many operated for centuries this way.
Do we have examples of rulers doing this?
Oh, definitely. Caliph al-Hakam II, back in the 10th century, is
Yeah.
a famous example. He invested huge amounts. And he didn't just rely on local talent either.
Yeah.
He actively recruited doctors from places like Baghdad, North Africa, brought them to Córdoba, and he provided them with medical texts, translations from Greek, Indian, Persian sources. He was trying to concentrate the world's best medical knowledge.
Really building a center of excellence. So this universal funding, this commitment, who was actually walking through the doors, was it just Muslims or just the poor?
No, that's the other amazing part. It was truly universal. Muslims, Christians, Jews, all treated. Locals, foreigners treated. Rich, poor treated.
Seriously, no distinction.
No distinction for admission or basic care. It wasn't like today where you might have private versus public. This was the healthcare system for everyone.
That idea of universal health care predating things like the NHS by centuries.
Many, many centuries. It's quite humbling, really.
And what about women? You mentioned separate wards, but were women involved as practitioners, which would have been, well, unusual for Europe at the time?
Very unusual for Europe, but not so much in Al-Andalus. Women were actively involved. They were trained in midwifery, of course, but also in nursing and even, remarkably, in surgery.
Women surgeons in the 10th century.
Yes. And they had specific protocols in place, too.
Like what?
Well, female patients were preferably seen by female staff. If a male doctor needed to examine a female patient, it wasn't forbidden, but he had to be accompanied by a female nurse or a relative.
So, like a chaperone system, was that just about modesty?
Partly, perhaps, but it seems more about maintaining professional standards and ensuring patient comfort and propriety. It wasn't just about hiding things away, it was about structured, respectful care.
That's quite thoughtful. Did this compassionate approach extend elsewhere? What about mental illness, for example?
Yes, that's another key area. Mental illness wasn't typically seen as demonic possession or something requiring punishment, which was common elsewhere. Instead, they created special wards within the Bimaristans for psychiatric care. The focus was on compassionate treatment, trying to understand and soothe patients, not chain them up in dungeons.
That difference in approach, it points to a fundamentally different way of thinking about illness itself, doesn't it? More scientific, less superstitious.
Absolutely. While, much of Europe might attribute plagues to divine anger or bad spirits, doctors in Córdoba were practicing clinical observation,
What did that involve?
looking closely at the patient, studying their pulse, their urine color, consistency checking body temperature, taking detailed medical histories. It was about gathering evidence.
Almost like detective work.
Kind of, yeah. Using those observations to arrive at a diagnosis, then formulating a treatment plan, which could include medicines from the pharmacy or even quite sophisticated surgery.
And this is where figures like al-Zahrawi come in.
Exactly. Al-Zahrawi, or Abulcasis as he was known in the West, was a Cordoban surgeon. He wrote this massive encyclopedia of medicine, and a huge part of it was dedicated to surgery.
I heard it had pictures.
It did. Detailed illustrations of over 200 surgical instruments, many of which he designed himself. Things for cauterization, amputation, even dental work. It showed an incredible depth of anatomical knowledge and surgical skill.
200 tools. Wow. Did his work have much influence outside of Al-Andalus?
Oh, immense influence. His surgical texts were translated into Latin fairly early on.
Really?
Yes, and they became standard surgical manuals in European medical schools for centuries, like 500 years or more in some cases.
So European doctors were learning surgery from a 10th century Cordoban text well into the Renaissance and beyond?
Pretty much, yes.
Yeah.
It underscores just how advanced that knowledge was and how directly it fed into the development of Western medicine, even if that link was later obscured.
Which brings us to the big question. If the system was so advanced, so influential, why did it fade away? Why isn't Córdoba famous today as the birthplace of public health care? What happened?
Well, the short answer, unfortunately, is the Reconquista, the gradual Christian reconquest of Muslim Spain.
How did that impact the hospitals?
As territories changed hands, many Islamic institutions, including the Bimaristans, suffered. Some were closed down, others were repurposed, turned into something else. Some were just destroyed in the conflict.
And those that survived?
Often, they were taken over by the church. And while the church certainly provided charity care, the model shifted. Healthcare became less of a universal public service based on scientific principles and more tied to religious charity again.
And the scientific knowledge, the female practitioners.
Much of that declined or was suppressed. Female doctors and surgeons largely disappeared from the record in subsequent centuries in Spain. There was a definite regression in some aspects of medical practice and organization.
So the system itself and even the memory of it just sort of eroded, especially in European consciousness.
It really did. It faded. So much so that when modern European hospitals started being established, say in the 17th, 18th centuries, very few people likely remembered that these sophisticated publicly funded universal hospitals had existed in Muslim cities 600 or 700 years earlier.
A great forgetting, as some historians call it.
That's a good way to put it. A great forgetting.
Which is why it feels so relevant to rediscover this now. We tend to think of public health care as a relatively modern, maybe 20th century invention.
Exactly. But Córdoba had it, this sophisticated system, when London, as one historian quipped, was still mostly a cluster of wooden huts. It really puts things in perspective.
So if there's a key takeaway from exploring 10th century Córdoba's healthcare, what is it for you?
For me, it's this fundamental idea that society has a responsibility to care for its sick, everyone, regardless of who they are. And that this idea isn't new. It came from a specific worldview, a political philosophy that saw health as a public good.
Not just a private commodity or a matter of charity.
Precisely. It wasn't a perfect system. I'm sure it had its problems like any system does. But it worked. It provided care on a scale and level of sophistication that was unparalleled for its time.
It shows what's possible, maybe, when science, ethics, and good governance come together.
I think so. It's a powerful historical example of that alignment.
So let's leave our listeners with this thought, circling back to the start. In the 10th century, if you got sick in most of Europe, you prayed. If you got sick in Córdoba, you saw a doctor.
A stark difference.
It really is. And maybe it reminds us that progress isn't always a straight line forward. Sometimes important answers, maybe even blueprints for a better future, are waiting to be rediscovered, buried in the past.